Hello, my name is Stacy Wills. I'll be speaking to you today on health disparities with a focus on health literacy. Over the last decade, America's had major advancements in healthcare. We are using new technology to deliver healthcare and save lives, and are constantly coming up with new research on how to treat diseases. Overall, Americans today are living longer, but for a number of racial and ethnic groups, access to good health care is hard to come by. We are still, as a nation, unable to lower our incidence rate of health disparities. In an effort to lower the incidence of health disparities, the Senate introduced legislation that aims at reducing health disparities by focusing on health literacy. Healthy People 2020 defines health disparity as a particular type of health difference that is closely linked to social, economic, and environmental disadvantage. Health differences refers to differences in the presence of diseases, health outcomes, quality of health care, and access to health care services that exist across racial and ethnic groups. With a look at health literacy, what exactly is health literacy? The National Institute for Literacy defines health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic health information. According to the National Assessment for Adult Literacy, approximately 36% of adults in the United States have limited health literacy. This is a grave problem. Berkman et al. States that health literacy has helped to increase the incidence of health disparities. Those with literacy problems are most likely to report inadequate health status. The cost of having low health literacy on the public health system is well over $18 million a year. This is due to misunderstood services, repeated ER visits, complications from misunderstood services. All these are related to health literacy. Who are our population that is at risk? Older adults. Research shows that after an adult has reached the age of 60, their health literacy declines. Minority immigrant population are at risk. Low income residents are at risk. Residents with limited English proficiency, those that are unable to speak or understand English clearly, are at risk. Some of the issues that are faced by residents or populations with low health literacy are populations with low health literacy are unable to understand discharge instructions from hospital visits. Some are unable to carry out medical instructions, and others are unable to understand educational materials or prescriptions provided. These are major patient safety problems. Senate Bill 3211 was introduced by Senator Parker with an intent of the legislation to improve healthcare access and outcomes, to reduce unnecessary healthcare spending by addressing the issue of health literacy. The bill states a need for a statewide task force to be established to study and evaluate the health literacy of residents in the state of New York. The objectives of this bill are to examine the ability of residents to access available health services and have effective communication with healthcare providers, to examine the barriers that present residents with low health literacy from receiving proper care, to identify groups at risk for low health literacy, to examine whether increasing health literacy and providing appropriate care would decrease the expenditure on the public health system and increase the efficiency of healthcare providers. The Bill S3211 was referred to higher education on 1/31/2013. The Joint Commission believes that effective communication is at the base of patient safety. I totally agree. The safety of patients cannot be secured without handling the issue of health literacy. The American Nurses Association supports all initiatives that are taken to address health literacy problems. ANA also supports all research on evidence-based practice associated with increasing health literacy. I believe that health literacy plays a pivotal role in healthcare. Without proper literacy skills, populations that are affected have adverse health outcomes. Low health literacy affects a large percent of our population, and it plays a major role in increasing costs. In order to eliminate health disparities, healthcare workers and organizations must come together and support any legislation put forward by the Senate. We must work together to ensure everyone has equal access to health care and good health outcomes. Thank you.